My specialty is colon and rectal surgery, and I've been doing that for about 15 years. So in retrospect, I chose the specialty of colon and rectal surgery because I feel like I and the patients win 80 or 80% of the time. And what I mean by that is most patients come to see a colon and rectal surgeon because they have problems around their rectum, they're having problems having bowel movements, they have pain, itching, they're worried about their hemorrhoids. What they're really scared about though is that they have cancer. And so 80% of the time, they don't have cancer. They have a problem we can take care of in the office and make them feel better. The 20% of the time that they come and they do have cancer, we cure that 70% of the time. So I feel like I'm able to partner with the patient and win 90+% of the time in terms of making them feel better. I moved here to Augusta from Vanderbilt University, where I have been for 15 years. I actually did my colon and rectal surgery training at the Leahy Clinic just outside Boston, and my general surgery training I did at Vanderbilt in Nashville. I was fortunate enough to go to medical school at the Medical College of Georgia here in Augusta. So in some ways, this has been a little bit of a homecoming for me. The other side that I really enjoy about being a doctor and just believe so strongly is that by designing how we take care of patients, not just the how do I take care of Miss Jones, but how we run our clinic, how people greet folks when they come in the door, how we design our operations, how the nurses flow through clinic, how the physicians work with the other care providers in clinic. All of that makes an impact on the way somebody is cared for and the way they perceive their care. The advantage that a patient has in coming to see us at the Digestive Health Center, and specifically coming to see a colon and rectal surgeon, is our expertise within diseases of the colon and rectum and anus. And so they are seeing a physician that really, that's what I take care of. I like to say all the time, I'm a one-trick pony. I'm really good at that trick, but I don't specialize in a variety of things. I focus my attention on those diseases because I feel like that helps me give patients the best information that I can, because I am so focused on just what their disease is. Within the Digestive Health Center, I also have the wonderful advantage that I have surgeons that take care of gallbladders and hernias and liver disease. And so I have surgeons available to me that take care of a wide variety of problems, so that if I see a patient that has other problems, I don't need to try to figure out how do I do that. I have a colleague literally right down the hall that I can talk to. I think the biggest advantage in a patient choosing to be treated in an academic medical center, and obviously I'm biased, I work in an academic medical center, and so I freely admit that, but I work in an academic medical center because every day I am surrounded by other learners, and those learners challenge how I treat my patients. So they don't just accept that what Dr. Herline does is the status quo and that should be the way they do it. They recognize the expertise and experience Dr. Herline has, but then they're always asking, why should we try and do this way? Shouldn't we try and do it differently? Weekly we have conferences. In fact, just this morning, just a few hours ago, I'm sitting with 7 of my gastroenterology colleagues as well as my other surgical colleagues, and we are discussing, would there have been a different way to take care of this patient? And so I feel the opportunity that a patient has is to not just get great care, but to get great care where the question's always being asked, is there a better way to do this? Is there a better way to care for this person?